I've heard people say, oh, pediatric nurses, you guys are so like bubbly and so la la la. Like, it's not that hard. And I'm like, no, it can be very hard.
Hey guys, welcome back to the Nurse Talk podcast. I'm your host, Mia, and today we have Brielle.
Hello. Thank you for having me.
Thank you so much for coming.
I'm excited.
So, what inspired you to become a nurse?
I wanted to be a nurse ever since high school.
Oh,
So
wow.
I worked for, well, not worked, but I volunteered for the autism program at our high school and helped with like the Special Olympics and stuff like that. And I just was always drawn towards kids and just helping people in general, like serving the community in some way. So I remember I was torn between child life specialist in the
wow.
hospital
Yeah.
and being a nurse. But what really pushed me to be a nurse was my two uncles. They had both died within like few years of cancer, and we were in and out of the hospitals. Specifically, I think it was called Sloan Kettering in New York City. It's a huge hospital, mainly focused for cancer patients. And we were in and out. And I just remember seeing the nurses come into the rooms, taking care of my uncle, and just like watching them. Like I literally was just watching them come in and out. And I was like, I want to do what they're doing.
Yeah.
Like they were helping my uncle make them feel comfortable. And I'm like, I want to do that. Like I want to help people in that way. I wasn't really like interested in like medicine and like the medical aspect of it, like giving medication and stuff like that. But I was like, I just want to help them. I'll do whatever for them. So when I graduated high school, I worked at a pizzeria for a year.
Love that.
Then, yeah, oh my gosh, best thing ever. And then I became a nursing assistant. So I did start working in a nursing home. I always say, like, for me, I feel like it's so important to start from the bottom and make your way up. And that's literally what I did. It was a very humbling experience. And I worked with the elderly, which they're like big kids, honestly.
Oh, yeah, of course. Yeah.
And I loved it, but I was there for 6 months only because personally, the nursing home, I just didn't like connect with it. Like I loved them, but it was a lot.
Oh, yeah.
And I was so young. I was like 18 years old carrying these like
That must have been such a shock.
it was very humbling. But I also remember like driving to work and like crying because I was so stressed because I was very small too and they were really big and a lot of people didn't want to help out in the nursing home. So it's like fend for yourself type thing. So I would do whatever for them. But I remember one time this older man, he was so cute, this elderly man, he was like, honey, you are too young. What are you doing? And I'm like, I'm helping you. And he's like, but you shouldn't. And I'm like, what? And I would just have so many conversations with them. And they had so many stories to tell, so many veterans I took care of. Like, it was just amazing. And then I knew at that point, like, okay, nursing is definitely what I want to do. Even though this was like, you know, quote unquote, the dirty work, like they say, like just the bedside care and stuff like that. I was like, I still want to help people. Like, I still feel drawn to it. But I knew pediatrics was the way to go.
Oh, yeah, for sure. Yeah.
So, but that's where my nursing journey started, honestly. That's what got me into it, got my feet wet into like the nursing assistant role. And then I was just like, I'm gonna keep going.
I'm surprised it didn't scare you off.
I know. Honestly, I'm surprised too, because a lot of crazy things happen. I mean, nursing homes, you know, it's very different. You're dealing with, you know, end of life as well, or just if they have dementia, Alzheimer's. So you see, you know, you experience a lot of different things. But no, it kept me still, even though I cried, I was like, I still want to do this. I'm like, I love this. So yeah.
You had the will, you had the fight. You were like, I'm going to do it.
I was like, I need to help people. I've always loved helping people. I'm very empathetic too. Like, I will put everyone else before myself. Like, I don't know, helping people. Like, I always felt like I was called to serve, honestly.
Yeah.
My senior year quote was by Mahatma Gandhi. I don't know if I said the name right, but it was like, the best way to find yourself is to lose yourself in the service of others. Like, that's like, I always resonated with that. I was like, yeah, like I get joy from helping people. That's like where my happiness is fueled too.
Oh, yeah, absolutely.
So
Well,
it
it's
kept me
beautiful.
going. Yeah.
Do you ever find that sometimes it is a disservice to you when you're actually on the job?
Yep.
Yeah,
And
I'm the same exact way.
Yeah.
It's like I'll go 14 hours without peeing or eating, and I'm like, and they're like, why don't you just take a break? And it's like, well, someone's screaming over there.
Yes. Oh,
You
no,
know?
it's so true. I feel like nurses all have that common personality trait too. Is like we're so selfless,
Yeah.
but we really don't know how to like prioritize ourselves. It's like, wait, we shouldn't do that because it's like, no, I got to take care of everyone else. I've struggled with that. And every nurse that I meet is like the same.
Oh, yeah.
Like, it's just who we are. That's
Yeah.
why like nurses are special kinds of people.
Absolutely.
And everyone can relate because we're all the same exact person.
Yeah.
But it's true. I've learned throughout my nursing journey though, like how to prioritize that, especially with like the health issues that I developed in my career. So yeah, it's a
awesome.
journey to say the least,
Well,
but it's a beautiful career.
The nursing field is lucky to have you.
Thank you. So then after nursing assistant, doing all that, I still was going to school at the same time. But I originally applied to an RN program, got in the RN program. So I was in RN school, made it to the third semester. So I was 21, 2021. And I was in a really toxic relationship, you know, those first relationships that you think are like
Oh yeah.
everything. They're
And all,
not.
yeah.
They're literally not. And that was like taking a toll on my life. And I was trying to balance that, my job, and school. And I literally failed out of the program by
Oh,
0.5,
no way.
0.5%.
Oh my gosh.
And I was devastated because it was the third semester, so I had two more left. It was the pediatric and OB rotation, and I loved it. But by 0.5. And I remember I was like, I like froze in time because I was like, what am I going to do? Because, you know, you have to reapply to schools, there's wait lists. And I was like, I can't wait years to get into a nursing program. Like, I have to finish it now. So I panicked. And then I like gathered myself together, found an LPN program. It was an accelerated 10-month program. And they were starting. So I had failed out that spring. It was like May. And then I applied to the program. It was starting in September. So I was
wow.
like, you know what?
Quick fix. Let's do it.
I'm like, I have to graduate when I was supposed to graduate.
Yeah.
I'm like, I'm just going to do it. And I had a hard time with that because, you know, sometimes people don't understand the difference between LPN and RN, or people think, oh, what's an LPN? Like, go RN, you know? So it was also like humbling for me because I was like, I'm going to be an RN. Like, that's all I focused on. And I was like, you know what? No, like, I'm not going to give up. I
Yeah.
will be an RN, but I'm going to go this route because it just made sense. Like, I wanted to get it done. So I applied to the 10-month accelerated program. And I did it. And then I finished in 2019. I graduated. And I was really happy because it was like I was going through so much transition in my life, you know, healing from a toxic relationship, trying to find myself again, and failing. I felt like I failed myself.
Yeah.
So that was like a healing journey. And then coming at the end, graduating was like an amazing experience. I was like, I did it. Even
That's
though it wasn't
amazing.
the exact path I thought it would be.
Hey, that's okay.
Yeah, still got it done. So,
Hey.
yeah.
Did any of your credits transfer? Like from the RN?
No.
That's what I find wild.
Me too, because a lot of it, like when I was in the program, I was like, I did this already, which made it, you know, a little bit easier. But yeah, nothing transfers. It's like you start from the beginning.
So if you were to do a bridge program between LPN to RN, would any of those past classes
Some of them do.
transfer for the future?
Some, but because I took so many prereqs for that nursing program, those would actually help me in an RN program. But I've looked at different schools because I do want to go back, which we'll get into.
Yeah.
But some of them, I basically would have to start like with the first beginning, like the fundamentals of nursing.
Oh no.
So I feel like I've done that like many times, but I'm like, okay, it's fine. Like I could use a refresher.
Okay, we'll fly through that.
I'm like, it is what it is. But yeah, I've taken fundamentals like 10 times, it feels like.
Yeah.
But I'm like, it is what it is. But yeah, I think there's some LPN to RN programs, bridge programs, where you just skip the fundamentals part and you jump right into the rest. So it's you miss.
Which would make sense
yeah.
because you've been in the field for so long. Like you don't most likely need the fundamentals in any way, shape, or form.
Right. I'm like, okay. I guess the refresher is good. That's like the positive outlook of it. But yeah.
Yeah. So what drew you to pediatrics specifically?
I've always loved kids, honestly. And I feel like I'm a kid at heart. Like I'm very animated. I'm very like bubbly. Like that's just, I connect with kids so well.
When I
'Cause
tell
I'm a
you,
big kid
you
myself.
look like you're still 18 though.
Yeah. No, wait,
Like you're still like a little baby.
I know, I get that a lot. It's so funny because even at work, which we'll talk about that, like they're always like, how old are you? Mm-hmm. Like you're like one of us. I'm like, no. But yeah, like I don't know. I've always loved kids. They're such resilient, strong, like the strongest patients I've ever had. Resilient. They're so innocent. They see like the good in everything, and it just pushed me to want to help them and just always be there for them. Like they needed us, and they still do. Like they need nurses that care about them and are patient and kind, and the parents too, because you're dealing with the kids and the parents. It's not just the kids. But yeah, I love their little spirits and how they push through everything. They're resilient. They made the job worth it. Like every day I would look forward just to like seeing their faces, you know, it makes a difference.
It
But
really does.
it really does.
They're so cute and kind, and
They
you can see the
are.
light in their eyes, and you're like, oh,
That's what it
yeah,
is.
yeah,
I'm like, I
yeah.
love kids so much. And like I said, I just connect with them. I'm like, I'm a big kid myself. I'm like, let's watch Disney. Let's get you
Yeah.
all dressed up. Yeah. So I love kids. They're amazing.
What's something about pediatric nursing that people underestimate?
That it's not just the kids you're taking care of. You're
Yeah, yeah.
taking care of the parents as well. And that's something that like I didn't realize until I was in the field. Like I'm like, oh, it's just the kids. It's the parents too. Your patients are the children and their parents. And I feel like no one really realizes that. Like they think it's all, and it is bubbly and fun and exciting, but you're
Oh,
dealing
no.
with,
Yeah.
it can be intense sometimes. And it's totally understandable because you're taking care of someone else's kid. And like, I see how I am with my dog. I can't imagine when I become a mom.
Yeah.
I'm like, you better do everything right with my kid. So
Yeah.
it's a challenge in that sense because they think it's just, oh, like I've heard people say, oh, pediatric nurses, you guys are so like bubbly and so la la la. Like it's not that hard. And I'm like, no, it can be very hard. You
Oh,
know,
yeah.
you're dealing with the parents and also sometimes, especially in my career, which we'll get into like the different
Yeah.
realms I've worked in, sometimes kids can't communicate what they're feeling or how, you know, express their pain. Sometimes it's hard. So you really have to go off of body language and stuff like that, which that's something I've learned. Now I'm like, I can read body language very well because if they can't tell you, you can observe how they're feeling, if they're in pain or anything. So yeah, you got to be patient.
I think that's something that has always maybe pushed people to adults. Like if I've talked to others, I'll say, you know, why not kids? Why not pediatrics? And they're like, oh, I don't want to deal with the parents.
Yeah.
That's like their number one thing. It's never the kids, it's the parents.
Yep.
However, I want to remind people, as someone who worked on, you know, adult med surg for 2.5 years,
Bless you. Oh my
the kids are now the problem.
Interesting.
So you'll be taking care of the adults,
Yeah.
and a lot of them are older. Your demographic is most of the time, you know, 70s, 80s. I mean, of course, there's middle age in there. But now you're dealing with their children who come in and demand.
I believe it.
So I don't think it really matters. I think family is
Yeah.
going to come in and be family regardless.
It's true. And it's like, it's understandable, but then sometimes it's like, trust us, which I understand
Yes.
is also hard to spell, which is why I'm big on like communicating with the parents. Like that's like a whole, I really took pride in that and still do. It's like the parents have to feel comfortable with you.
Oh, yeah.
But sometimes, yeah, it could be like, just trust me, I got you, I love your kids. But it's
Yeah.
true, yeah. I didn't even think about that too.
Yeah,
And that's
I think it pushes
hard.
people away
Yeah.
from pediatrics, but I'm like, guys, family's going to show up regardless of the
Yeah.
age.
It's so
And they're
true.
going to demand and they're going to yell.
It's so true.
Because they lose all their, no matter how old that family member is, whether it's a parent, a child, a grandchild, they're losing all sense of control, and everyone else is in the wheelhouse and they have no say. So
And
they
it's-
come in and they try to, you
It's
know,
scary too.
I can't even imagine. So
Yeah, it's valid.
when I think about like having kids, I'm like, I'm gonna be there and I'm gonna make sure they do X, Y, and Z. You
And
know,
especially
so
being
I
a
get it.
nurse,
Yeah,
too.
yeah. Oh no, I'll
Forget
be there
it.
every day. You know, just making sure they're doing it
Yeah.
right. But so I get it. But it is true.
Yeah.
I think people either overestimate dealing with the parents or they underestimate the parents.
Yeah.
And then with kids not being able to vocalize like what they're feeling,
It's harder. They're nervous.
your assessment skills got to be on point.
Oh, yeah.
Oh, yeah, for sure. Okay, so you worked in many pediatric nursing roles. So you did long-term care, medical daycare, and then outpatient clinic.
Yes.
I want to start in long-term care and ask you like what your role looked like and what kind of patients you saw.
Yes. Long-term care is it was hard initially. Hard
Yeah.
because it was really sad.
Yeah.
That was the hardest part. So I was at the hospital that I worked at the time. I was a nursing assistant first there. So after the nursing home, I went to that hospital to
that's
continue
great.
being a nursing
At
assistant.
least you had some like,
It helped.
you kind of had a baseline.
Yeah,
you knew
like
what
I
you
knew
were-
the
yeah.
patients,
You knew
their
where everything
needs.
was.
Exactly.
Who worked there, yeah.
And it was hard starting off like that too, because I've never seen patients in this type of condition before. We had kids that weren't able to walk, talk. They needed full total care. Some were born normal and then they were abused. There was a lot of different cases. And that's the hard part, is the story behind them all. So when I became a nurse, I was excited because I already was familiar with it all. But there was like so much, even more love because I just knew them so well. but it was still hard to see. Like, I think the hardest part for me was, we help them the best we can, but knowing, there's only so much that can be done for the long-term care patients because it's really just, creating a comfortable environment for them, keeping them stable, and trying to progress them in their goals to the furthest they can go. Like, we knew some patients would never be able to walk again, but being able to stretch their legs and have them stand up. And this is where I love occupational therapists, because they taught us how to help the kids, even though they can never walk, let's get them in equipment that can help them stretch their body out so it can feel like they're standing up. And just those little things, it just made you really appreciate life more.
Oh, absolutely.
And just seeing how they were still so happy. And even if they couldn't talk, or, the limited knowledge they had, or, they show up every day, you know what I mean? And that to me was just everything. I was like, I love this. Like, it really puts life into perspective. It really does. But I would say that was the hardest part, was just adjusting to, I'm so used to seeing everybody walking around every day. And then when I started that job, I was like, wow, like, there's people that are hurting. There's people that are suffering. And, it opens your eyes.
Yeah.
It really does.
Yeah. I had a couple patients in the NICU that were there so long, and you needed so much medical attention. Trach, G-tube, brain dead, all the things. And it's like, it makes you have like a really deep like thought process of like, some people's quality of life is like zero.
Yeah.
Like, it's horrible. It's horrible to see.
Terrible. And it's insane. And I worked with patients with trachs, G-tubes as well. That was actually my main group. There were G-tubes, trachs, and it was a lot. I remember at first, even though like I was like ready to jump in and like be the nurse for them, sometimes I would get nervous because I'm like, am I hurting them?
Yeah,
am I
because they
doing
can't
this
tell you.
right?
They don't even react sometimes. Yeah.
And that's where the body language came in. But it was a long-term care, but it looked like a little mini hospital floor. It really did. So we had like a mixed group, but it was mostly children that were either bedbound. So it was different. I've never experienced that before. Like, just having to, like, I always talk to my patients. They wouldn't be able to respond back, but sometimes I get like a little chuckle, but that's how I connected with them. Like, I was always conversing with them, telling them what I was doing. And that's so important too in nursing. I feel like, it could be a very draining job, but just still like keeping that communication, even if patients can't communicate with you. It's so important because I could see in their eyes or just their grimaces, like, they can hear, So it was I missed that job all the time, but I moved to Florida. So obviously I couldn't take the job with me.
Yeah.
But the best 5 years.
Oh,
there.
you did that for 5 years?
I did that 5 years between nursing assistant and then nursing for a year and a half. But
so how many patients did you normally have as an LPN?
I had, in that particular unit, I would have sometimes at most 11 or 12.
11 or 12? Did you do med pass, or was an RN doing med pass?
Med pass. And the respiratory treatments, we would do those too.
Oh my God.
Yes. A little bit of everything.
That sounds like a really busy day.
It was.
Oh my
God.
God.
I did work night shifts, so I feel like it was still busy. And crazy things would happen in the middle of the night.
Oh, yeah, of course. They happen all the time. 24 hours. Yep.
Yeah. But I think night shift helped me because it was a little bit slower. You don't have like everyone else outside of nurses on the floor coming into the rooms, different doctors and all that stuff. So it was different, but it was definitely slower pace, but we would do more. So I would do the respiratory treatments. I would do the vests for the respiratory vests and all that stuff. So that was new too, because I've never done that in nursing school. Like, I just did, they teach you the basics of meds, injections, and that's about it.
Yeah.
So I learned a lot more of like respiratory stuff too, which I thought was pretty cool. I always like learning, so I was open to anything. But we did all the med passes, respiratory treatments. We would even get them dressed sometimes in the morning. And because I already had the nursing assistant experience, it was like natural for me to just want to clean them too. Like, I would, freshen up their faces, brush their teeth, even though we had nursing assistants helping. Yeah. But I was like, I've done this before. I can't just pass it off.
I feel like that's the only negative from becoming, CNA to LPN or RN or whatever, is you kind of revert back to like your old responsibilities, and you feel like you're not doing right by the patient if you don't do like all of the things that you used to do as well. But there's only so much time in one shift. So
it's true. Like, I would actually feel guilty.
Yeah.
Because I'm like, no, but like I've
But
done
what
this
if that
before.
person doesn't come and do their
And
thing?
that
Or what
too.
if they don't do it as good as I do? Yeah, yeah. I 100% understand
Yeah.
that.
So I was doing a little extra.
So after reflecting from long-term care, we're going to kind of compare all of them.
Yeah.
But I wanted to ask you at the end of doing all of these different types of pediatric roles, did you like having more turnover rather than essentially no turnover at all, like at long-term care? Like you see the same patients almost every single time, or did you learn to prefer like a lot of change?
I actually loved it. And I think because I loved that it almost like family. So it
Okay.
was like I was with my family every day, my kids, even though they weren't mine, but like I would even buy them clothes like for the
Oh,
holidays. Like
yeah.
I actually felt like their mother. So
Oh,
I
yeah.
loved that I would see them all the time. Now I did have, unfortunately, like some patients that we've lost.
Yeah.
And that
Yeah.
was very hard, especially because I'm seeing them all the time, right? Versus like, oh, we saw them once, twice, and now they're gone and they're back home or whatever. It was like, I see them all the time. And if they were sent out to the hospital because they were super sick or they passed away, that was really hard because you feel like they're one of your kids.
Oh, absolutely. Yeah.
So
You worked with a patient for a year, it feels like.
yeah, you get so
Yeah.
connected to that. Like that's family. So I would say I loved it, but in those moments it was very hard too because you felt the loss
Oh,
really
yeah.
hard,
Of
like if it
course.
was your own family member.
Yeah. And I think also one of the benefits of not having a lot of turnover is you kind of knew what you were getting into.
And that too, like
Yeah,
the
yeah, yeah.
routine.
Yeah, yeah.
Yes, that's actually really true. I had like my whole system down. So there was, and I'm also very type A and like I love my routines. Like,
Yeah, yeah. So
so
am
there
I.
was like a lot of comfort in that too. I was like,
Yeah.
okay,
Well,
I
this
already know
person
what to
doesn't eat
do.
until 2 a.m. He's just one of those. And then this guy,
Right.
so you kind of have like a system rather than like new
Yes.
patients every single time. It's like,
And it was really nice because I knew what to expect, but also what was nice too is the consistency as far as like I was here last night. They don't normally do that. And then, like if the
yeah.
day shift would like report to me like something that happened, I'm like, okay, what happened last night? They were fine. Like, like I don't know.
Yeah, yeah.
It's very different, but it was comforting too because it's like you felt super confident, like knowing your patients
Oh,
so
yeah.
well that
Yeah.
like you knew the patterns and everything.
I
But
know, like
yeah.
I could tell you his whole note. I could tell you exactly what time every med is
Yes.
due. Yeah, so
Exactly.
yeah.
Yeah. So it's I actually liked it. Yeah.
Yeah. Okay, so I know we've kind of answered this a little bit, but what were some bigger challenges or learning moments in long-term care that you had?
To take my time. That was like one of the biggest things. Cause not that I like to rush, but like, if I heard a kid crying in one room and I'm still in the other room working with one kid, I learned like I can't be rushing because I'm not fully showing up for my patient. I need to take my time with each patient, appropriately, like, or
Yeah.
get help for someone, like if there was a kid that was like fussy, but take my time with each kid because their needs have to be met, right? And also, am I a good nurse if I'm rushing? You know what I mean? And I was in an environment, again, night shift, it's slower pace. Take your time, read thoroughly. I would triple cross check like everything. Like even when MedPass, even though like now we have like advanced systems, like even like the medication dispensary, like everything's more advanced. I was still like checking my med, checking the computer, checking my like, okay, this right patient good. And I always had everything organized. Taking my time was the biggest thing that I learned. Like you need to, it's okay. You're gonna get it done. Show up for your patients, take your time, and you'll be fine. And that helped a lot, especially mentally. Because as a nurse, you want to do everything at once. And I'm like, but I don't have octopus legs. So like I can't do that. Octopus arms, like I cannot show up in
Especially with
that
like
way.
11 patients. Yeah.
Yeah, so that was like one of the biggest things that I took out of long-term care too.
So you also worked in a medical daycare.
Yes.
What does that look like and how does it compare to long-term care?
It's similar but different. So when I moved to Florida, that's when I started. I never even heard about a medical daycare before.
I've never met anyone that's worked in
Yes.
a medical
They're
daycare
pretty
before.
big down here.
Yeah?
Which
Okay.
is really nice. So essentially, it's not 24-hour care, but they're open usually from like 6 a.m. to 6 p.m. And it's basically children that have medical needs. Like we'll have kids that have ventilators, trachs, G tubes, even behavioral issues as well. Not necessarily like they have a G tube or anything like that, but it could be behavioral issues, diabetes. So I had like a mixed group of kiddos, but they were higher functioning. So they weren't bed bound. They were running around. And, it was cool because, parents have to work. So they would drop the kids off with the nurses at this daycare. We would take care of them still. They had medications or feedings, but they were in a daycare setting. So it's like an open room. We like sectioned off area for playtime. and feeding. So it was like, it almost felt like babysitting, but it was fun. But it was like they still need a nurse, you know?
Yeah.
So I learned a lot. I learned about vent patients in that setting because that was very new to me. And even having a diabetic patient and the importance of like monitoring her and all that. I learned so much, but like I said, it was like a free open space. So it's like my patients are running around there. And that was really nice because I wasn't used to that. I was just used to like my bedbound patients. So it was cute to see these kids like progress and get better and
play
Like I really enjoyed that part of it. And I also did transport with them too. So sometimes we would take them home on a bus and they needed a nurse. So I did a little bit of that too.
Oh, that's interesting.
Yeah, so that was different too. So it's like me with all these kiddos singing. I put music on for them.
And you would just have to sit on the bus with them and make sure they got home
and they got
safely?
home, get the parent's signature. So I felt like it was so intimate too, because not only was I with them all the time, like in the center, but I was taking them home and dropping them off.
Okay, so that was the same. That was the
It was
same
the
job.
same. Yep.
So would they go and pick up the children, or it was only they would drop them off?
So we would pick up. Now, some kids got picked up and some didn't. I'm not sure how that worked in terms of like who would get picked up or not.
Yeah.
But we would pick them up in the morning. I didn't do that because I was just way too early.
Yeah.
Especially coming off night shift. I was like, nah, that's a lot.
Wait, you did both?
I didn't do the morning. I just did taking them home. Yeah.
No, but you worked night shift and then also worked this job on the side?
Oh, no. I meant like
okay.
the transition from night shift.
I'm sorry.
No,
I was
you're
like,
good.
what?
And then being there like 5 a.m. I'm like, that's insane. Yeah, no. So I would take them home. But it was cute. Like I said, it felt intimate because I'm like, I'm seeing them at the center, but now I'm like seeing their homes, where they go home to, meeting their parents. So it was nice because the parents, they would want to know how the child did. And I would tell them, I took care of him today. I took care of her, and tell them, hey, this is where we, need to improve. So it almost felt like a teacher too at the same time. But I'm like, that's literally what nursing is. Like, it's not just medications. It's like, we're taking care of them. We're teaching them. We're wanting them to grow. Like, you become a therapist, I feel like, at some point too. Like, it was a really good job. I feel like I grew so much, even skill-wise, just having different types of patients, but also learning how to communicate with the parents and seeing them in a different light as far as like running around and then taking them home, seeing where they come from, understanding the patient better. Like, it was amazing. Yeah.
That'd be so interesting. And you say that they're really common down here. I have not really heard of them.
Yeah, they're essentially just daycares, but for children who have medical conditions. Yeah.
Well, I love that they are available to the parents, because it must be really scary to try to find someone who you trust.
It's true.
I mean, in general, but with, event or
and then like you think like you have to work, you have to provide for your kids. So it's like they get a break, they could do what they have to do, and we take care of them. And even sometimes when I would drop them off, I would meet the night shift nurse because they would have home care nurses at the house waiting. So I would also report to the nurse, hey, this is how he did today. These are our concerns. So it was nice too. Like it's like you hand it off to the next nurse, but it reminded me like there's just so much you can do in nursing. Like, it's not just limited to a nursing home or a hospital.
And I feel like I always learn like new roles.
Yes.
That people have, and I'm like, oh, I didn't even know that was a thing.
Yeah, it's amazing. That's why I love nursing too. It's so diverse.
Sometimes when you work in a hospital, you only see like the hospital setting, and then you start to hear about all these little things that you can do on the side. I'm like, what?
I love it.
Yeah.
Nursing it's that job. Honestly,
it is.
That if you want the it girl job, right, you can even get it to a nurse. And there's just so many things you can do. And I think that's what I love about it too, because you're not limited to one thing. In my personality type, I like to do a little bit different things, clearly, because I've done quite a bit. But
yeah. So for that outpatient clinical experience, we're going to get to that towards the end. But I wanted to see which one, whether it's medical daycare or long-term, which one do you feel like shaped you the most?
I feel like long-term care.
Yeah.
And maybe it's because it was like my first nursing role. But it just changed my perspective on life and just to appreciate life more. I feel like it was such a good foundation to start for me in my journey, because it helped me in the rest of my journey up until now. So definitely long-term care.
Awesome.
Yeah.
So would you like to share any memorable stories?
Yeah, I will say the long-term care nurses that I worked with were like the strongest nurses I've ever met. And because emergencies didn't happen as often, because these kids, we kept them pretty stable and there wasn't much that they could do to put themselves in harm's way, essentially.
Yeah.
When there was we were working overnights and it was super quiet. It was like 2 a.m. Everyone had done their med pass. We were just observing the monitors, making sure everyone's sleeping. And one of our kiddos who had chronic respiratory issues, he completely desatted and like out of nowhere, but it wasn't even normal. So we were like, oh my gosh, like what's like in the middle of the night, like not even expecting it. But these nurses, like you would think that they encountered emergencies all the time. And I was still very, very new. So I was like, oh my goodness. Because, it's not like we're in an ER
Yeah.
where we're constantly seeing, so we're used to it. But they were like, stop what they were doing, ran to the room. We had a whole team. Everyone helped each other. And that was the thing too. Like, just because it's your patient, it's not like you figure it out. All of us would go into the room. We had one person watching the others. And they were like on it. Like I remember I was like, I'm gonna be like you guys.
Aw,
They were the
yeah.
best mentors, like super confident, get the job done. And it was scary, but they kept, they were in check, they were like focused, and we did everything we needed to do. And the kid ended up turning out fine. But it was a shock for me because I wasn't used to like emergencies happening like that. And just seeing how they handled it, I was like, wow, that's just nursing. That's who nurses are. Like no matter
Yeah.
what environment you're in, like that resilience and strength, like you focus on the patient, you get it done. And I love that. And I think it's so important when there's emergency situations to not panic
Oh, yeah.
because it can go really south. So that was one thing I was like, wow.
It definitely makes for a better experience when you don't panic.
For sure.
But it's totally understandable if you do.
Yeah,
It like
100%.
when it first starts to happen.
Yeah, you're like,
Oh my God. Yeah. I
Yeah.
remember like my first couple of events that would happen with babies or, even with adults. But,
yeah.
you're like, oh my God. And then you do it, you get a couple reps and you're like, this is a lot easier if I just woosah.
Right. It's
It is a lot
true.
easier because when you're in the panic, like all your thoughts kind of float to the sky and you have none and you're like, I don't know anything.
No, it's like, wait, how do I take a pulse? Like, wait, what do I do? Literally, yeah, no, that happened to me a lot in the beginning. I'm like, and that's the thing, like, I don't like verbally freak out, but I just freeze. It's like I'm frozen in time and I'm like, I forgot everything. I don't know what to do. So seeing that was like, they helped me a lot. I had the best mentors. Yeah.
Okay, so I have some rapid fire questions for you.
Let's do it.
Okay, go-to trick for calming a scared patient.
Honestly, getting the kids involved. So I learned that pretty early on. Like, even with my long-term care patients, it was a little bit different. But when I started working at the daycare, a lot of the kids would get scared, like, I don't want the med or I don't want the, and I'm like, let's do it together. And I would teach them, even though they probably didn't know what the meds were, but I would include them in what I was doing. So this is what I do first. I put my gloves on, I do this. Or I would get a stuffed animal and they would demonstrate what I was doing to them. Best way to calm a kid down. Just get them involved so they feel like they're doing something too.
I feel like that's like the child life, like,
Yeah.
like,
Yeah.
like I know you never actually became a child life, but I feel like that's like,
It's
you're
like a
kinda like-
skill
yeah.
that they do. Yeah. It's the best thing. Honestly, like they immediately, they're like, wait, okay, like I can do this. And you want to build that confidence in them too,
Oh,
because
yeah,
it's
of
already
course.
such a vulnerable state that they're in. But definitely getting them involved changed the game. You get a completely different demeanor, just they're like more willing to listen to you too.
Mm-hmm.
And that I learned in the medical daycare setting for sure.
Yeah.
Yeah.
One word to describe pediatric nursing.
Okay. Definitely the first thing I think of is advocacy.
Okay. That's good.
I don't know if I can have a second word, but compassion. Those two. But definitely advocacy. I feel like, again, children are so vulnerable. They're so innocent. And when they're sick, even more so. And a hospital, any medical clinic can be such a scary place for them. So I think advocacy, because even though they have their parents, they still need a strong team behind them when it comes to like their medical care. And pediatric nursing, you become like their best friend. Like you're their cheerleader, you're rooting for them. You're also like literally advocating for them. Like if something's wrong, get their needs met, because, parents can't be there for them all the time. And those are their advocators in life. But now when they're with you in the hospital or any medical setting, it's like you're their advocator. So definitely advocacy.
I love that. That's a great sign that you said that. Toddlers, school age, or teenagers?
Oh my goodness. I love them all, but I love my toddlers. And even school age, honestly, toddlers, they're just so funny. Their personalities are like coming to life. So it's like just the little comments they make or just their little behaviors, or no, like I find it so cute, like I love toddlers, and they're willing to learn and they're curious. So I think that's what I love too, because they're like, what are you doing with it? You know what I mean? School age, they're fun too, but I guess it depends on the age group. Sometimes they could be a little like, I don't want it, or like sarcastic, or like, rude.
Judgmental.
Judgmental, that too. And then teenagers, it's funny because it's like they're still kids, but they're like, also like gonna be adults soon. So I feel, and I was that teenager. I was like, I'm grown, and I'm
I
like,
don't
no, you're
need
not.
your help. No.
Yeah, like, I don't need you. I don't need this. Like, what in the outpatient clinic, which we'll obviously get into, but I did allergy testing as well. And I would always offer my little kiddos lollipops. Like, we're going to do an allergy test. I'll give you a lollipop after. The teenagers, they're too good for lollipops, but I always like, so do you want a lollipop? You're not too grown, right?
Yeah.
So I still could like engage with them, but at a different level. But I love my toddlers. They're just
so cute.
Yeah.
I find them so entertaining, even when they're being like bad. I'm like,
it's so cute. I know.
this
I'm
is
like,
the best.
I don't want to encourage this, but you're adorable.
Something you wish every parent knew.
Their voice does matter, and their observations of their children are important. I think some things I've seen in healthcare is like gaslighting, not intentionally, or maybe they don't realize it, but even like from doctors or, the parents are vocalizing their concerns. And sometimes it's quick to assume, oh, they're just overreacting, or they just need to trust us. But they're actually very observant, and they do know their children really well. And the more information they can give us, the better we could provide care.
Absolutely.
That is one thing. Like because I've heard parents say like, oh, well, I don't want to be over dramatic, but I don't know. And it's like, no, like, one thing I do is make sure I don't invalidate the parents' feelings, because it is super important. I know one day I'm going to be a mom. You're going to be a mom soon. Like, we're going to be on top of our kids, especially being nurses. And I never downplay what parents tell me. Even if they don't understand maybe why their child has this going on or these symptoms, I just making them, like, hearing them out, like validating, okay, tell me more, because the more you can get from them, the better we can like give care to.
Of course, because, they're giving you information you can't gather from the child because it's a child. Yeah, I see that a lot. But it's like, they know their child in and out. You don't. You walked into this room as a physician most of the time.
Right.
Walked into the room for 5 minutes, hardly did an assessment.
That part.
I think you should probably listen to the parent.
Yeah, it's so true. So and I'm really big on that. Like, even though they can drive you crazy sometimes.
Oh, yeah.
I know that they, like, their kids are their world. They're going to give me everything that I need to know. And then if anything, we can bring them comfort and peace if they think something's wrong, and we can reassure them, hey, actually, no, that's normal. Or, you know what I mean? Or this isn't really that big of a concern. This is what we can do. So, yeah.
I couldn't agree more. A pediatric ick that you did not expect.
This is actually really funny because I feel like every nurse has one thing where they're like, that grosses me out. I just can't do it. For me, it's boogers.
Same. Okay. I will literally puke everywhere over a booger.
Can't, but ask me to like deep suction secretions from the chest. Got you.
Oh, no.
But I can't do boogers.
I can't do any phlegm or any.
Yeah.
Earwax?
Yeah.
Okay, honestly, when I see like grown adults walking around with like flaky earwax, I'm like, oh, no.
I cannot. Boogers and earwax, I can't. Which is funny because we've probably dealt with a lot of more like disgusting things. But that for me is like, ugh. Like, I'm like, ew, stop doing that. Like,
no, like just the thought of it.
Yeah.
I could puke.
Yeah, literally.
But I've literally had like another person's like poop on my hand and it wasn't a big deal.
Right, like streaming down my arm, like diarrhea, like freaking like C. diff. But I'm like, boogers, absolutely not.
Advice in one sentence for future pediatric nurses.
Have patience, take your time, comma, and show compassion.
I love that. If you can do that.
Straight to the point.
Yeah, if you can do that.
You're solid.
You're solid.
That's all you need for kids. Literally.
Literally. What is something in pediatrics you've learned that you think every nurse should know?
It's super important to remember that they're kids and that they're scared and they're not sure what's going on. So to communicate with them at their level, incorporate whether it's their favorite movies, shows, or into conversations, or just make them feel not like a patient, but like a human being. Like, play joke, you know, make jokes with them, play their favorite music. Like I would always do that, like make the environment comfortable because they're kids. And it's easy for us to just see patients like, okay, this is what we have to get done, make them feel better. But it's like, don't forget that they're little kids in a hospital or any setting, which, you know, normally we associate like those who are sick as elderly patients, you know, or adults. But it's a lot for a kid. And I think if you make it feel homey for them, it changes the experience. And you talk to them like if you're one of them, like a friend, it changes it for them. It really does.
I would argue that you can take that advice and give it to any nurse.
Yeah.
Because you don't always know the education level of a lot of your patients, even if they're adults. And I have found that sometimes you do need to dumb it down just a touch.
Yep.
And you need to explain it in like literal, just like everyday life wording.
Yes.
Sometimes you need to get on their eye level, just like with kids. And sometimes you just need to take a breath and be calm.
Yeah.
And they relate to you in such a different way.
It changes the experience for
Yeah.
both of you, like the nurse and the patient, like that relationship changes because it's nerve-wracking for them. And also it could be nervous for us sometimes too. Like, I mean, if you're meeting new people all the time, you're like, okay, how do I handle this situation? How do I approach them? You know?
But I think that's what makes a really good nurse is not only your assessment skills with, you know, what's the hair pattern on their calves and what are their breath sounds sound like, and
Right.
but the assessment skills of like, where is this person at? What is their personality? Like sometimes you only know this person for like an hour and you're having to like discharge them and give them all of this information.
Yes.
So you really have to assess what is this person's personality, their education level, all of these things, because you can't bring the same personality to every patient.
You can't. It's
Sometimes
so
I
true.
have to be like, oh my God, yay. And sometimes I have to be like,
Enough
no.
is enough.
Yeah, you know?
Yeah.
And, you know, for each patient, they might, I don't know. It's just completely different. So I feel like that's such another vast, like, responsibility of a nurse.
Yeah. Right. Not just
Yeah.
the clinical stuff, but
Yeah,
also
yeah.
the individual.
I feel like that's what makes the nursing job so hard.
It does. Yeah.
Because it's like, it's not just like the clinical aspect or like the skills. It's
No.
like having to like meet them where they're at and like show up for, you know, 6 different patients or 11 different patients in different ways.
It's true that come from different backgrounds, different
Yeah.
like just so much. Yeah, it's true. And it's more, like you said, it's more than just the medications. You also have to learn them as a person, you know, because also I feel like depending on the patient, like their environment could be the reason why they're in this
Absolutely,
situation.
yeah.
So it's like we help them here, but how can we help them out there or transition back into, you know, regular everyday life? You know what I mean? So yeah, nurses are a little bit of everything.
A little bit of everything, but I'm so happy that we have other resources like social work and like
Yes.
you know, you gave a shout out to occupational therapy earlier, physical therapy. I mean, gosh, they help in such a
It's
big way. I'm like,
amazing.
my God, they're here.
Literally. And it's amazing. And I love like seeing everybody come together because nurses, I really believe like we are the foundation. Like the doctors that I've met that appreciate their nurses, they will always say, no, you guys are my eyes and my ears. You're everything. And I appreciate that because sometimes it's forgotten. I feel like
Yeah.
people forget, like you said, nursing is more than just the med pass. We're with the patients all the time.
The longest amount of time. Besides the
longest.
parents. We're
Yeah.
like with them all day.
Yep. And the assessments we have to do.
Yeah.
I mean, and also just the compassion. Like I've never met a nurse. I know there's some out there, but I personally have never met a nurse who doesn't have that compassion component to them. Like
Yeah.
it's just in them. Like they want to know their patient. They want to help them outside of just take your medication. Like it's like helping them as an individual. We do a lot. That's why it's emotionally, physically.
Oh, yeah.
It can be a lot.
Even when I have met a nurse that I didn't feel like was compassionate in any way, I would take a step back and kind of like observe how they are with their patients. Most of the time, they're pretty sweet and have such compassion for their patients.
Right.
They just don't have it for other people.
Yeah, it's true.
So I'm like, okay, well, you know, hey, if you can be nice to your patients, that's all that matters. So-
Seriously, because that's what we're
Yeah.
here for at the end of the day, right?
Oh, absolutely. Okay, so as we know, kids say the darndest things. So I want to know, what is the craziest thing you have had a child say or do?
I've had a cute memory and then I've had some crazy funny ones, but like sometimes these kids would just cuss. Like, and for me, like you want to laugh,
Oh yeah.
but you're like, I don't want to encourage this either.
Yeah.
But like we had some like siblings or like, people that would go to like the kids in the daycare setting would develop relationships. Like it was like going to school and seeing their friends every day. So hearing their little conversations, they'd be like, shut up, you're ugly. Like, and it's like, or like cussing at each other. And I'm like, guys, like I actually felt like a parent sometimes because I want to laugh and I want them to learn how to like defend themselves and, speak
Yeah.
up for
Yeah,
themselves.
yeah.
But sometimes I'm like, all right, guys, stop. And then they would start, but why? You're not the boss of me. And I'm like, the Hispanic mother in me, even though I'm not a mother yet, I'm like, all right, like,
Actually, I am today.
I'm like, sit your behind down, all of you. We're having quiet time for 5 minutes. So it was funny because it's like I'm a nurse, but I'm also like a parent too. But I did have one patient, cutest. I had cut my hair really short at the time,
Like how short?
like very
Oh,
short.
yeah, that is very short.
I was like, it's new me and refreshing haircut. And she had come in one day, she's like, Miss Brielle, your hair is short. She goes, I want my hair just like you. And I was like, oh. A few days later, she came in with the same short haircut. And I was she goes, I look like you now. She goes, I wanted to look just like you. And I thought it was so cute. Like you get the rebellious kids that want to act out and be crazy. And then you have your little like sweet, wholesome moments where they're like, I want to be just like you. Like,
Oh, that is really sweet.
Yeah. So those kids, I love them. But they drove me crazy sometimes. But those little moments, even the crazy moments, they're worth it, because they're kids.
It's funny at the
It
end of the day.
is.
Yeah, yeah.
Until they're adults and it's not funny.
Yeah, no, it's not funny. Please don't cuss at us. I would like to get into more about your LPN role. And I want to just ask you, do you feel like the LPN role is respected and understood?
I would say yes and no. I definitely, especially because when I first started the LPN route, I also didn't even understand it. I thought it was like a downgrade from an RN. But now being an LPN and really understanding the role, it's funny because it is similar to an RN. I mean, it's practically the same. The things that are different might be like I can't do an IV and maybe administer some medications, but all the roles that I've worked in, like I've had my friends that are RNs are like, you're literally doing what I'm doing. And I think after COVID too, nurses, LPNs were able to work in hospitals, which was something that wasn't a thing.
Yeah.
So I feel like over time, the doors have opened for LPNs. So I would say for those who are not sure what route to go, my path was what it was because I failed out of school and I wasn't sure what I was going to do. And I panicked. I was like, let me just continue. And it's a great option. I also think LPN's a great option for those who are super young and maybe want to learn the hands-on approach. RN school is also hands-on, but I feel like LPN, because I was in the RN program, I did more hands-on as an LPN, where I felt super confident. Like in clinicals, they're like, you're the nurse for the day. Like, let's do this. And
I
I'm
love
like,
that because I did not feel that way.
yeah. And I felt that in RN school too. I was like, I feel like I could do one medication and then that was it for the day.
Oh, yeah.
Where in LPN school, I'm doing med passes. Like I got so much confidence with the hands-on part and skills because my instructors were very much like, and the funny thing was they started off as LPNs and now they have their masters and they're teaching. And I love that. And honestly, even though it wasn't the path that I thought I would go, I'm really glad I started from LPN because I learned so many things and I feel like it's going to make me a better nurse and more confident nurse. I also feel like when it comes to jobs, a lot of people didn't know that LPNs can do a lot of different things. We could do home care, we could do clinics, we can do remote work now, hospitals. So I think it's just as diverse as RN, but I'm definitely big on like, if you want to continue your education, definitely keep going because that's what I'm going to do.
What are some common misconceptions about LPNs?
That they're just nursing assistants. That's a big one.
Yes, yes, yes.
And I'm like, no. Especially because I've been a nursing assistant before. And I feel like nursing assistants, I love them. I have so much respect for them because I was a nursing assistant. But LPNs are not nursing assistants. They are nurses.
They have their own patients.
They have their own patients. I guess depending on the setting and where you are, but they can give medication. They can do everything in RN. Can, like I said, except, I know care plans is a huge thing in RN school. Like we don't develop care plans in that sense.
We don't develop care plans either.
Really? Oh.
We don't. It's like a big thing. I mean, I don't know if you've seen like the memes and the, and the shorts and the reels and all the things, but they're like, remember when we were in school and have to do care plans?
Yeah, like I remember
Where did those go?
that was a bulk of our in school because I was like, oh my
We
gosh,
don't
that's a
make
lot.
care plans.
That's crazy. So essentially, we do this a lot of the same things.
We do a lot of it.
Yeah.
No, you take care of the patient and you do all of the clinical things that you need to do.
Yeah.
And you talk to every single person that's in the hospital, basically, the
Literally.
physicians, the dietary,
All of it.
all of it. We have the same role.
Literally. It's the same. And
It's the same.
and I will say too, the RNs that very few I've encountered that would be like, oh, you're an LPN. But most of them, so loving. Like they're like, girl, you're one of us. And it's true because that's how I see it too. Like, even if I'm working with a nurse that has her bachelor's, I'm like, we're all the same. Like, we're a team.
Yeah.
I don't see titles. I see nurses. We're going through it together. Let's join together. And it always was like that. Like, I had the best mentors that were RNs and they just took me under their wing and it was great. They didn't, what is it? Nurses don't eat don't eat the youngins. What's the term for
eat their young?
Yeah. I never experienced that. I have so much respect for everyone in healthcare, but I love my RNs.
Yeah.
I'm like, I see them as like the big sisters. Honestly, yeah.
I did say we don't do care plans, but they might do that in like home health care and all of those things.
Yeah, I think it really
In
does
different
depend on the settings.
but
Yeah.
like in like an acute like hospital setting, we don't do care plans. But I might be speaking.
But I thought they would be in the hospital setting too, though. Mm-mm. But yeah, that makes sense. Maybe home
I mean,
care.
I do like a plan of care for the day, and then at the end. But I'll just say the goal for today and like any special needs that patient has.
Oh, okay.
And then at the end of the day, I'll write a note about the shift and
not
what
like
was
the lengthy
accomplished.
ones they would have us
Not
do in
like
school.
no, not
The
a
book
two,
report,
3 page,
practical-
4
yeah.
page. No, we don't do that. They might do that in other settings, but
Yeah.
at least in the ICU, we don't do care plans. So I'd like to get into your new role. So you are a lead surgery coordinator,
Yes.
correct? All right. Would you like to tell me about that?
Yeah, so it's very different.
Mm-hmm.
I guess I definitely don't expect myself to be doing this as an LPN. But again, back to how there's so many things you can do.
Oh, yeah.
I'm really grateful for the opportunity and the experience. I've learned so much. I think it teaches you as a nurse to be a leader in different ways and to show up for your patients in different ways. So I went from working in the outpatient clinic and then transitioning to fully remote, which I feel like every time I tell people I'm a nurse and I work from home, they're like, how do you do that?
Yeah, yeah.
It is different, but I'm having a lot of phone calls. Patient education is still a thing, just on a call with a parent.
Yeah.
And I also do a lot of admin work. So as a surgery coordinator, I manage the cases for the surgeons. So I'm doing the back end stuff. Like they see the patient show up that day. I'm taking care of like what procedures are we doing. So I'm learning about a lot of insurance stuff too, which can be a headache sometimes, but the coding that goes into procedures, what the procedure is, how to explain it to the parents, how to help parents find out their financial, like what it's going to look like. So it's very different, but I feel like I've added more skills to my plate. Like I'm a nurse, I'm educating, I'm comforting parents on the phone. Sometimes parents are crying on the phone. So even though I'm not face to face with them, I'm still like providing that level of care and comfort over the phone, which I never thought I could do that on a phone call, but they feel amazing. Like I've had parents who they feel more comfortable now for the surgery process because I'm basically guiding them through, just not in person. So I was unsure how that would look like because I'm very much, face to face, like, hi, how are you? And then transitioning into that role, I was like, how can I still do that? But it's all in the tone. It's how you speak to them. And that's so important. And a lot of times, like I have a direct line. So they have, they call my direct line and they're like, hi, Brielle, like, I just have questions. And they feel so comfortable. And I feel like it changes the game for them when it comes to surgery because surgery is a scary process in general. But now you're talking about kiddos that need surgery. I mean, I can't even think about that for my own kids, like that's scary. So to still provide that nursing care, but just over the phone, you could still do it. And also I'm taking care of me too.
Oh yeah.
Especially with my life and, getting diagnosed with a chronic illness. I have lupus. That changed my nursing life as well. Cause it's like, how can I show up for my patients if I can't show up for myself? So in the remote position, I needed that for the time that I was in because I was going through a lot of health issues. But again, I was like, but I got to be there for my kids. I got
Yeah.
to be there for my kids. But how can I show up for them? You know, if I can't even show up for myself or be my best self. So that role helped me because it helps me so much to be able to take care of myself, but still take care of others. Like, I feel like I could still do what I love, but also now learning how to take care of me too. Instead of, having to struggle to get up in the morning because my joints hurt or whatever the case may be, I can be in my home, be in my comfort space, but still show up for my patients in a different way. So it's been a transition, but I'm so grateful for the opportunity, honestly, because I could still do what I love, but also
Yeah.
take care of me too.
That's awesome that you're
Yeah,
not being exposed to so many things now,
that
especially with children.
too.
They carry so many viruses and
They
bacteria
do.
and all those things. And you
Yeah,
maybe taking a step back because you do have lupus is
yeah.
probably really
It helps. And
beneficial.
I honestly, it's crazy. I felt guilty at one point because I was like, nah, I don't feel like a real nurse. Like
Oh no, you're a real nurse.
it was something that I had to like really like come to grasp with because I was like, wait a second, like I don't feel like a nurse. I'm like, no, you are a nurse.
They wouldn't pay a nurse because they didn't need a
It's
nurse
true.
to do the role.
It's true.
Because like you can't just have like a call center type of job for $15 an hour, have that person do that. No, you
Exactly.
can't. You have
And
to have
it's
a nurse who
so
has the
true.
background. Yeah.
Yeah, and it's so true. And it's like remembering like again, like there's nursing is not just one way. There's so many different ways. And I feel like because of all the skills and things I've learned in my other roles, for this role, because I know the different age groups for kids, because I know parents are going to ask, how do I talk to my child about surgery? How do I present it to them? I had the in-person skills so I can talk to them about it on the phone. And, I think for me, the most rewarding thing, because I do miss that face-to-face sometimes because I love that face-to-face communication. I feel like that's so important though as a nurse. So you can never get rid of that.
Oh
I don't
yeah.
care how big AI gets. There is nothing like human connection
Oh,
and
I agree.
interaction.
Yeah.
But I will say I love that in this role that I've had parents feel so much better and express gratitude and you could feel their relief after crying and just like thank you so much for taking the time. And it's just a phone call, right? But it's
Hmm.
not just a phone call to them. It's life changing. It could be life changing for them. It could change the post-op care for their child or knowing that they can call us for post-op care
Oh yeah,
needs.
absolutely.
Easily accessible to get in touch with us and hey, I'm concerned, like what does this mean? You still feel that rewarding, like I'm serving my community just from home,
Yeah.
comfort of home.
What is the focus of the surgery center you work for?
So it's ENT, ear, nose, and throat.
So have you learned a lot about that too?
I have, and when
It's such a like a very specific.
it is
Yeah.
specific. So having the trach experience was definitely helpful.
Yeah, of course.
But I've also learned so much more. So I was in the clinic when I first started for a few years. I recently transitioned to remote last year in October. But I was in the clinic, so I think that helps too. I also went into the OR a few times, so I got to see the procedures, and that was the best way for me to learn because
absolutely.
now I tell the parents what to expect when they go into surgery, what it looks like. But I didn't know what adenoids were. And I mean, we all know tonsils, but adenoids, I was like, what is that? So I learned so much. And I remember when I started the job, and I still have this binder, I call it my Bible. It has all the procedures, the patient education, and I studied that. I studied
Yeah.
each procedure. And now I'm like, and I didn't know what it was. I had to Google.
Oh yeah.
Like I would listen to the surgeons and they would teach me, but I was like, I need to visualize this. So being in the OR, but also seeing like YouTube videos, like using all my resources, it helped me understand what they're going through and what it entails. And I learned so much and I love learning too. So even though I'm not a fan of the boogers and all those things, I learned a lot that I didn't even know. And I feel like that's important because I don't think nursing, you can never know everything. You're always going to constantly learn things. And I never thought I'd be with, in a specialty of ear, nose, and throat. But I've learned so much that I've been able to help even my adult friends too. Like, you know what I mean? Like I enjoy it honestly, even though it's not what I thought I would be in. I embrace learning new things and I truly enjoy it. And I feel like the more knowledge you have, the more power to and the best nurse you could be too,
Oh, absolutely. Well, I love that you have that new role.
Thank you. I love it. It's so
I'm kind of
nice.
jealous.
Yeah, and you know what? Honestly, a lot of the remote roles for nursing, because I've even seen for RNs too, it's case management.
Yeah.
Or if you like insurance, which I personally don't, but a lot of the coding and stuff like that, that's also like a lot of remote jobs that nurses can do too. So it's different. I don't know. But I feel like it's good to do a little bit, like for a little bit if you can.
Oh, absolutely.
But I feel like nurses do miss, like naturally will miss that
Oh, yeah.
face to face.
I feel like I would miss it, but I feel like I would absolutely love like a remote job, not gonna lie.
Yeah.
And I think I would actually probably like you, like hate insurance, but I think it'd be such a good learning
It really
experience.
is. Yeah.
Like once you've done insurance, I feel like you really have the ability to like kick back and like argue some things and like really
Yes.
know what you're talking about. So I feel
Yep.
like there's so many nursing roles that could, being bedside, you learn a lot
Oh
about
yeah.
people, about life, all the things. But there's these specific roles like what you do or case management or insurance where you really learn a lot about like life skills,
Yeah.
like that aren't clinical based. They're like,
Oh yeah.
I'm like, case management. What if you find yourself or your family member one day in a setting where they need X, Y, and Z resources
Yeah.
and you already know of everything?
It's so true. And that's why I'm like, even though it's not like the traditional maybe nurse job, I love that I'm learning new things. Like you said, for life experiences, like maybe one day I'll have to go through it with a family member and I'm like, I know this. I
Yeah.
know the back end of it, especially
Yeah.
with insurance, because that is like the one part that scares a lot of patients is like we're giving the care, but then it's like, how much is it going to cost? What does this look like? And being able, like, I'm always transparent with the parents, like, this is surgery, but this is what to expect when it comes with the financials. There's going to be these three separate fees. Call your, like, being able to guide them in that way too, because insurance can be really intimidating. Like, a lot of
It
people
is.
don't understand their own insurance plans. And that's something I've realized in the community, and I'm learning more about insurance so I can educate parents as well. Like they think insurance will cover everything 100%. I wish, but you got to put out a lot of money before it kicks in. You know what I mean? And that's something that a
Unfortunately,
lot of
yeah.
parents, like a lot of people don't know that. Like, no, your insurance isn't going to cover it 100%. Like you're going to have a portion. And sometimes even when you meet, you know, the deductibles, you still have to pay after. So there's a lot of stuff that isn't taught that I feel like is so important. So I love that I can help in that way too, even though I didn't think financials and insurance was something I'd do as a nurse. But it's also something now I know, and I feel like I'm still helping them in that way. You know what I
You
mean?
absolutely
So
are. Yeah. That's
still
awesome.
serving.
What does a typical day look like for you as a surgery coordinator?
Now I can sleep in a bit.
Yeah.
And then I have my office set up, so I just get situated. I get my little breakfast, start the day. I always check my voicemails because now I have a personal line. So you're still triaging in a way. Like I see what the parents are calling for, prioritizing in that order who to call first. I make sure my surgery patients are taken care of, everything's sent out to the facility. So it's more administrative, but it's the same duties in terms of like triaging, organizing how I'm going to go about my day, like how we do when we're in the hospitals or clinics. Like these are the patients I'm going to see, make sure I address these needs. How can we address their goals? Like what are we working on? So still the same, but just behind the scenes, it's a lot more quiet, I would say. But then when the phone calls kick in, then we're in the
Ring,
zone.
ring, ring,
So
ring, ring.
it's like you never know what you're going to get each day, but being in the comfort of my home is really nice.
That's awesome.
Yeah.
Do you have any memorable stories as a coordinator?
Yeah, I feel like I've had some really good conversations with some parents. They feel comfortable and they open up and we're talking about life. Or, I've had parents who some of their kids that we see have autoimmune conditions. And now that that's a part of my story, I'm able to talk to the parents and relate to them in some way so they feel comfortable. Or I give them recommendations on like doctors that I've met or in that specific field. So I almost feel like they're a friend. Like I'm helping them, but then I'm also like their friend. Like I've helped parents that are struggling to come to an agreement with surgery. So I explain to them, I make them feel more comfortable, and I don't know, it's weird. It's like a friend. It's like I'm a nurse, but I'm also their friend in the community and I want to help them. So sometimes it doesn't go smoothly on the phones or you get hung up on or cussed out. But sometimes it's great. It's like you're literally like a therapist, honestly. And I do enjoy that, even though I didn't expect it. I love
Yeah.
it because I love chatting, but I love helping people. And I think, you know, being able to help these parents during this scary time for them, even if it's for a short period of time or for a simple procedure, it's still scary. And being able to be that therapist for them, like it makes a difference. So I don't know. It's different, but it's enjoyable.
Yeah.
Yeah.
So looking ahead, what kind of nursing do you plan to focus on?
Oh my gosh, I'm really excited. So I was planning to go back to RN school years ago. So when I moved to Florida, which was in 2020, and no, I didn't move because of COVID, because everyone thinks that because I'm from Jersey, I
Yeah.
moved for good. No,
Everyone came down.
yeah, no, I wasn't that COVID traveler. But no, I planned to come to Florida once I graduated from nursing school, but I wanted to pay off my debt. So I moved to Florida a year after. So in the year of COVID, unfortunately, but I was still coming regardless.
Yeah.
And my plan was to go to RN school. I saw a school over here in Florida and I was like, okay, perfect. They have an LPN to RN bridge. Like I was ready to jump right in. And then I got diagnosed with lupus. And actually, that was after COVID. That's a whole other story in itself. But no one in my family has lupus. So I was trying to navigate that. And it was a really hard period.
Absolutely.
Like insane.
And the
Just,
timing was not
it was
great.
terrible timing. So I became a patient. And I realized I had to take care of myself first. So I put school on hold. But it's crazy because I think that's a blessing in disguise because I wanted to continue to get my RN and to go into pediatrics fully. But now going through all this and I'm, going to be returning to school soon, like that's in the plan. I want to go into like autoimmune, like that rheumatology niche. But as a nurse, I want to be able to help patients, kiddos that are also going through autoimmune diseases and even adults as well, help them navigate through that big transition in life, but help them get through it and not feel like, this is it, like my life's ending, like your life is just beginning. And I think it's ironic because I didn't expect to ever get diagnosed with an autoimmune condition, but going through this and learning so much, I could see how I can apply it as a nurse. And I feel like what better way to like serve as a nurse than like being able to also go through it. And now I can teach them how to go through it and get through it. And it'll be relatable. And I feel like they'd be able to, have more hope and faith because it's like, wait, she went through it. Like I can do it too. So that's what I want to go into. So I'm definitely want to go back for my RN, but I want to do something like that. Like almost be like a nurse coach, which is also like a field of nursing that
It is.
Yeah.
I feel like it's a little newer.
It is
Maybe it
newer.
isn't, but
It
to
is.
me it's new.
Yeah.
And I'm like, I love that too.
Because you help them, it's like they're your clients, but you help them get through. Like we teach them, okay, these are the meds you have to take, but it's like, let me show you how to get through it, how to be healthy physically, like health and wellness space, essentially. That's like what I'm drawn towards.
So if you were to become a nurse coach, would that be independently or would you have to go through like actual like huge companies that hire nurses to be coaches? Like how does that work?
Yeah, so you would have to be an RN. I know they're trying to transition LPNs into nurse coaching, but I think, like I said, knowledge is power. I want to know all the things, like, especially to be in that role, in that position. There are certifications. You do have to get a certification. So once you get your RN, I think it's like, there's programs that are like 6 months and as you go, but you do need a certification for it. And then, yeah, you kind of go from there. You can have your own clients, which is amazing, work from home.
Yeah.
But you can also work in the hospitals too. I think that's like an option or like clinics. But also as a nurse, you are a coach anyway.
I know.
You know what I mean? But
It's like it kind of surprised me that you needed 6 months.
Yeah,
I feel
I
like
think that's
our job is
the certification aspect, I think, is if you want your own clients. Like you can run your own business
okay, independently.
independently. Yeah.
Oh, wow.
But I have seen like on LinkedIn, like there are nurse coaching roles with like with companies. So I think you can do a little bit of both. Yeah. But I just love how it's like it gives like a therapy vibe almost, but you're being a nurse. So I definitely want to get into, especially now, like understanding the autoimmune population more. I'm like, I want to advocate for them because through my experience, I saw a lot. Like I felt like I wasn't heard. I felt like it was just, this is what you have. It is what it is. And that can get people down in a really low place. And I think of kids who have that. And I'm like, I'm an adult and I'm struggling with it. I can't imagine a child, So being that voice for them. And a lot of times autoimmune diseases go undiagnosed until you're in your 20s.
Which is wild.
Which is crazy to me. And I've heard so many stories of people like, I would tell the doctor this and they didn't believe me. So hearing that, being a patient, going through it myself, I'm like, I want to be their voice. I want to help them because I can understand.
May I ask how you found out?
Yes. So after COVID, I got the first strand. So when it first came out, I was working at the children's hospital. I got sick, but I felt fine. I couldn't taste or smell. That was it. And then a couple months after, I had a lot of hair loss, which was so weird. I was like, this is crazy. Like clumps of hair. I'm like, this is not normal. So everyone at the time was saying, oh, COVID long haulers. Like that was a big thing at the time. So I was like, okay, maybe I'm just having like lingering effects from COVID. Like we didn't know, it was so new. And then after that, and that was the year I was moving, in October, I remember I moved to Florida, but during that time, I was getting joint pains. So I thought I was having like carpal tunnel symptoms, like, oh, because my mom has that. So I was like, oh, maybe it's carpal tunnel. But then when I moved to Florida, months in, it was like debilitating. Like I had joint inflammation, like joints were swollen. I felt crippled. I couldn't walk. My
Oh
feet
my
were burning.
goodness.
It was getting worse. Went to the hospital, local hospital, got admitted, and they were like, we need to admit her. I was in the ER for 8 hours. I was like on morphine. I didn't even know what was going on. I'm like, something is wrong. Like I don't feel
Oh my
good.
goodness. Yeah.
And was in the hospital for 4 days, but had lupus. They tested me for all autoimmune because lupus presents as like rheumatoid arthritis, MS. Like it's a crazy disease. I didn't even know about, like I learned about it in nursing school, but I knew the butterfly rash.
Yeah.
And that was it.
They don't go fully like
No,
yeah.
girl, I never even had the butterfly rash before. It is like so much more that's involved. So, and I didn't even know, but yeah, it was the joint pains. And that's like my biggest symptom by far. But being a patient really, it changed, honestly, it changed how I look at nursing and it helped me better understand patients. But it also reminded me, like, as nurses, like, we have to prioritize ourselves too, because I definitely didn't. I mean, I was working overnights, barely sleeping, barely eating,
Picking
you know.
up overtime, doing all the
Oh,
things.
yeah, I'm
Yeah.
like grinding money, like, that's, you know, and it definitely forced me to take a step back. Probably more than I'd like to because I'm like go go go.
Yeah.
But it's actually really important to like slow down and take care of yourself. And I feel like as a nurse, I realized that too with lupus. Like, girl, you gotta take care of yourself.
Absolutely.
You know, like how can you take care of anyone else? But those were the symptoms. It was crazy. Never
Well,
in
thank
my
you for
life.
sharing.
Yeah.
I'm sorry you had to go through that, but I'm really happy that they found the answer.
Yeah.
Because sometimes in answers, although it's not what you'd like to hear, of course,
Right.
but at least you have an answer and you know how to move forward.
Yeah.
Because sometimes I feel like people
And I
can
see,
go
yeah.
into your situation and they just still don't get an answer.
And I see
So,
that a lot, or they
yeah.
feel stuck. That's why I'm like, no, like I feel you, but like, no, there's hope. And honestly, when I was a patient in the hospital, I had the best nurses. That was nothing too. They were like, you're one of us. We'll take care of you.
Oh, that's sweet.
You know,
Yeah.
so it was like to be a patient, to see how it makes you see things differently, and also reminds you like how important nurses are. Like, because they made my experience great because I felt like I was taken care of, you know? So it reminded me, I'm like, this is why we do what we do,
Absolutely.
you know?
Finally, if someone were to come to you and say, I'm really considering becoming a nurse, what would you say?
I would tell them, do it. If you love helping people and you just want to serve, do it. It is the most rewarding career you will ever have.
Yeah.
I would so encourage them. And it's funny because when I first started, when I was interested in nursing, I had met a nurse who was like, don't do it. Biggest mistake you'll ever make. And I'm like, that's crazy. You're bitter. I'm like,
Yeah.
why? But I never let it deter me from it. I was like, I want to help people. And it is rewarding. It really is. Like,
It's the
it's
best.
changed my life in so many ways, good and bad, but it's still the best thing I've ever done for myself was be a nurse.
When I reflect on my life, about to be 32 years, one of my favorite things that I've ever done is become a nurse.
Yeah,
You know,
I love it.
over all the traveling and cool things and, whatever. No, that's becoming a nurse is like top.
Literally, like it's the best thing ever. You're a superhero.
You can look back and be like, thank you to
Yeah.
yourself that you did it. Yeah, you are a
Exactly.
superhero.
We are. I'm like, we are superheroes. Like, are you kidding? Like, we are the most selfless people, and it's so fun, and you learn so much. I think it's just a humbling career too. It like reminds you to be present in your life, to show up for yourself, but then you're showing up for them too. Like, it's beautiful. I love it. I would
really
never
is.
do anything else. And it's funny because my husband was like, I want to go back to school, and he's like, would you do something else? I'm like, no. I can't imagine doing anything other than nursing.
It just doesn't make sense.
It just doesn't make sense. I'm like, I can't even fathom doing something else. It's nursing.
Who knows what path we'll take, but it's always going to be nursing.
I'm always gonna be going back to nursing.
yeah.
Like even different roles, I'm like, I still love nursing. Like nursing. It always will be like my biggest like accomplishment and pride and joy is just being a nurse.
Same.
I love it.
Well, thank you so much for coming.
Thank you for having me. This
I had a
was
good
so
time.
nice.
You did so good.
Thank you. This is so fun. I really did love it. And it reminded me of like why we do what we do. Honestly.
course.
Because I feel like sometimes you get so caught up, you forget.
Yeah, and then you sit down and you talk about how much you love it.
You're like, wait, I did do all that.
Yeah, you did.
I love what I do. Yeah.
All right, guys. Thank you so much for watching. Please don't forget to like and subscribe. Bye, guys.
Bye.